Thank you, first of all, for everybody being here. I will continue to let some folks in. Hey, Joseph. He's not incognito anymore. We're going to get started here. Let me share my screen with you. And Miss Erin is going to start us off.
Okay. So I also just wanted to first start by thanking everybody, certainly for your thoughts, your prayers, your support in so many ways, whether it's from you individually or the groups that you represent, your teams, your churches, your civic organizations. We have been incredibly blessed, and this certainly has been a very difficult time.
Are we frozen?
In a lot of ways. Certainly on individual, certainly families and friends are impacted by this. As a small organization, obviously we have been impacted, and Honduras as a country. Certainly this is a worldwide pandemic. It does not discriminate, and the small countries of the world have been hit hardest. They have had to close themselves off, and thus they've been hit very, very hard. And we have in many ways, but we have been extremely blessed. In many ways, it's because of the type of donors and the type of volunteers that we've been blessed with for the last 20 years. And so many of you, that you guys represent that right here tonight. So I thank you for that and for coming and listening to what we're doing. We are also blessed because at this moment, our staff is COVID-free. In the U.S. and in Honduras, we have one staff member who's under observation at this moment. So if you would keep our gardener, Daniel, in your prayers. He is under observation, but does not have a confirmed case, is not a confirmed case yet. But at this point, we have no one, everyone is healthy. And so we're quite blessed as a staff of 20 in Honduras and 6 in the U.S. And we are we have maintained our pre-COVID staffing levels, which we are very pleased with. And we've been able to continue our work in many ways. It looks much different, but because we have a very flexible staff, and let me tell you that blessed are the flexible, we have taken that to the bank. We have people doing all sorts of things that they were not doing before, but we have been extremely innovative and creative, and you'll see that tonight. So people are working hard, and we are still serving the people of the mountains, and I think you'll be pleased by that. One of the questions that we hope to answer tonight that we have gotten many times is, why not just cancel 2020? Why not just go ahead and give a blanket, just in the teams for 2020? And what I can say to that is, the quickest answer to that is basically just to tell you what our mission is. And the mission is to improve the lives of the impoverished children of Honduras by providing high quality, sustainable health care and enabling communities to become self-sufficient through health-related training and education. That is what our mission is. Obviously, our priority at all times is to keep our staff and our volunteers and our community members safe, and we will always do that. But if there is a way for us to get to Honduras safely to serve the people that we have committed to serve, then we will do that. At this point in time, we have medical and non-medical staff member, medical and non-medical volunteers who are committed to serve in November and December. If there's a way to go, they are willing to serve at that time. So we are keeping those 2 teams scheduled at this given time. And if there's a way to send them, then we will. we are realists at the same time, and we know that there is only, that there's a small chance that we'll be able to do that. And we'll talk tonight about what it would require in order for those teams to be able to go. But we are not going to cancel those teams, because we do feel that there is a chance that they could be able to go, and we do have people who are able and willing, and therefore we're going to hold out that if the door is open, we want to be ready. We are also looking at 2021 in the same fashion. We're preparing a schedule as we would any year. We're going to prepare that schedule, and then we are adapting it, as you'll hear about tonight. Our medical advisory committee has done a great job of looking at what we can do differently, how we can adjust and adapt given this new environment. Certainly things are going to look much differently going forward, but we will be ready when the time comes. If we have to postpone a team, if we have to make changes, we will do that. But when the door is open, we will be ready, and we will have teams that are ready to go. And so we will talk through all of that tonight, both what it will take to get teams on the ground, when we expect that to happen, though we have no crystal ball. I wish we did, but we do not. And then what the changes will look like as of now as we go forward. So we'll have Katie and Patty talk through those tonight. At this point, I will hand it over to them. If everyone could go ahead and mute yourselves. And then what I'll also say is save your questions until the end. But what you can also do so that you don't forget a question, if you have it as we go through the presentation, you can always use the chat feature in the middle at the bottom of your screen, and you can use that and pop a question in there, and we will see that and note that as we go through the presentation, and then we can the staff can come back to that at the end. So we can look at that. So, but thanks again for joining us, and I will turn it over to Patty now.
Actually, we're going to turn it over to Katie.
Okay.
Hi, everybody. It's good seeing your faces. For those, if anyone doesn't know who I am, my name is Katie Lowe, and I will talk with you guys about the hurdles that we have to overcome in order to be able to send a team. So you'll see here that the first thing is we need the borders to reopen on both sides, and international flights to resume for general passengers. And we also will need to have permission from the Honduran government to allow mission teams to return. And then the other big thing is the quarantine restrictions. We need for those to be lifted on both sides. Currently, there's a 21-day quarantine restriction in Honduras. So we're hoping that, as we move out of the higher levels of COVID, that those will be reduced to a point where we're able to, and then eliminate it so we can continue to send teams. Like Aaron said, the time frame on that is unclear. Unfortunately, right now, the COVID numbers are rising both in the States and in Honduras. So we don't know when that will be, but the good news is that we do have a troop of volunteers willing and excited to go again when the time is right, and our staff and team are ready for that to happen. So when we are able to resume, we will be ready and prepared to go full force. So I'll turn it over to Patty now to talk about the changes that will take place once we are able to send teams.
So let's talk about our actual teams first. Please know again that our Honduran medical staff, our U.S. medical staff, and our medical advisory committee have been working very hard at thinking through all scenarios, trying to come up with ways and policies and procedures that primarily we are putting in place to protect you as the volunteers, protect our staff, and then to still be able to give the best care that we can to our communities and our patients there. So that being said, one of the big changes will be that our teams will be smaller. Basically, this is to be able to manage a little bit better that distancing as much as we can. We know that that's going to be really tricky, but we feel like if we have a team that is smaller, we can manage that. So a team of 10 with a maximum of 12, that means it would be 2 people per room in Alfredo's house only. There will not be more than that. It would still, the decrease in numbers, you're going to have teams that are going to be a little medical heavy. So we still need that 4 to 5 medical folks per team, with one of them preferably being a physician. Again, number one, because they're the ones who we need their license to be able to get those prescription meds from AmeriCares for us to be able to use. But also, the physicians on the teams now will end up being our team screener. So every morning, whoever is the lead medical person on a team will be responsible for taking everybody's temperature, going through all those screening questions, and monitoring everybody's overall health throughout the stay. That is so we can stay on top of how well everybody's doing and nip things in the bud if perchance, and we pray not, but if perchance somebody gets sick. Alfredo's house, there will be changes there, and I'm not going to go into a lot of detail. Once we get teams back on the ground and we know that we're going to be going, your team training will be a lot more detailed, and we will go into a lot more of the policy and procedure changes then with your team. But just to remember that the highest areas of risk we know to be, both for virus and for vector-borne diseases, the airplanes and the airports. We can't protect you there. You have to be able to do that yourself. So thinking ahead to all the extra things that you need to bring to protect yourself there. Riding on the bus, riding in the van, or riding in the pickup trucks, because there's lots of people in a small space for an extended period of time. Sitting outside at night, that's not because of COVID, that's because of dengue. And dengue is right now very prevalent as it was last summer. So Honduras is dealing both with COVID and dengue at the same time. As well as the common areas of Alfredo's house. Now, we're not going to mandate that you wear a mask at Alfredo's house. You will have to wear a mask all day long and in the clinics. You're going to have to figure out what is the best thing for you, but keep in mind, because you are in an enclosed space with a lot of people, wearing a mask as much as possible is going to be smart, and it's going to be able to prevent the spread of anything to anybody else that is there with you, including our staff. So these are the places that we want you to be the most aware. Then the bigger changes and the things that I know that you're the most interested in is what's clinic going to look like. And there will be some big changes. The biggest one, or one of the biggest ones, is we will have an official triage station that will be manned by 2 Honduran nurses. They will do COVID screenings there. They will do vital signs there. They will do a more extensive assessment of presenting problems for the people coming in from the community. Those community members will also get their hands, or have to wash their hands and clean their shoes off before they can come into that general open clinic area. So they will be triaged so that we know who has the more emergent issues, who may need to see that advanced practitioner for prescription level medicine, and who is there for what we know to be that set list of complaints like headaches and upper respiratory tract things and skin and all of those that we can do over-the-counter meds for. Vitamins, deworming, measuring station, and pediatric eye screening, we are hoping to be able to keep in the same general area, so that one of the school classrooms would be used for all of them. So you would bring one family in, they would be weighed and measured, they would get their vitamins, deworming medicine, and have their eyes screened if they are a pediatric patient, and then move out of that area to then let another family come in. We feel like this is going to be more efficient in moving people around. It'll help us with crowd control a little bit better. Note, there is no fluoride treatment on that list. That is a high risk right now treatment to do. So Dr. Adan has said that he would like to take that off temporarily. Again, a lot of these changes will not be forever. Some of them will stay. That one will come back though. For dental clinic, Dr. Adan has chosen to actually just do emergency situations, only extractions, so we won't be doing any of the new sealants, no fillings, and seeing older teenagers and adults up to age 60. We want to keep those patients who we know can kind of self-control, that won't kind of wiggle around, that won't be crying. So his exposure is less, and the folks over 60 tend to have more of those pre-existing health conditions that may cause some problems when he goes to do extractions and that kind of stuff. So he wants to keep it within that age range. So at triage, what is going to happen is those Honduran nurses are going to designate families or individuals as to whether they need to go to well clinic or to sick clinic. Sick clinic, again, will be manned by all of our advanced practitioners on that team and the experienced RNs who have been on a team previously multiple times, know how to handle what's going on, know what to expect. And they will be helping with the sick clinic. So that would be folks who have a real-time issue going on that will need prescription medicines, would need referral. Those kind of patients would go to sick clinic. Well clinic is going to be those folks who are, again, going to just need those things that we know are commonly going to be used and asked for. Each family will get a pre-bagged set of meds. So Tylenol, cough medicine, all the creams, Tums, toothpaste, or toothbrushes, those kind of things, along with an education sheet. And these stations will be run by RNs, so they will be very education focused. Okay, so that is our hope, is we can get more folks in and out a little bit quicker that way. Every child will have a head to toe assessment done and make sure that those kids are okay. When you get to the eye clinic for adults, it's going to be very high risk for us to ask Giovanni to run the refractor because he would be right up in somebody else's face with that. So we will be reverting back to the Snellen charts for a while and just giving out readers. Readers are the majority of what we're handing out now, so that won't make things very different. So we've talked with Dr. Cruz about this. He totally agrees with taking this approach. And so again, this would be a temporary change. We will go back to the refractor.
Patty, can I interrupt for a second? Patty.
Sure.
Is anyone else having trouble with their internet? Yep, now everybody's frozen. Okay, it must just be me.
Okay.
If video is turned off for people, it'll help people that are having slow connection issues.
Thanks, Scott. Okay. So in the meantime, what are we doing? So our communities, to this point, no one has reported that they have any positive COVID cases in any of our communities. That, I believe, is a huge blessing for us right now and for them, and a true miracle. God has his hand on all of them, definitely. But we know, and they have voiced, that they are running out of the routine run-of-the-mill medications to do average things. So we are in the middle of developing a new pilot program where we will be putting into some of our communities a medication cabinet. There will be a health partner in each community who will be trained to manage that cabinet, to dispense medications for certain run-of-the-mill, average, everyday kind of issues. There will be documentation that they will have to fill out about who they gave it to, what they gave it for. Pasquale will be checking in with them every single week to go through that list and make sure things are still being done appropriately. Any issues that are more involved will be referred to Doctora, so she will be doing some telehealth with community members who have some more complicated issues and be able to help them figure out what to do and where to go for those. We will refill those boxes as we need to refill them. The nice part of this is there is another organization in Honduras called Aldea Global, and they do this on a much grander scale. So they have been our support, our resource in helping develop this. And as we move into the future, this will be something that we will encourage all of our communities to have in coordination with Aldea Global, if they so choose, as they graduate from our program. So we're going to be changing some of the focus of our education. It will still be a lot of what Pasquale has done with our advanced learning communities, those maternal child health issues and environmental health issues, but we are going to tend to talk a whole lot more and teach a whole lot more about average use and how to appropriately use those over-the-counter things. So we're really excited about this. We are moving forward with baby steps. We hope to get this off the ground by probably by the end of summer. And we'll hear a little bit more about that in a few minutes. We continue to do lots and lots and lots of education. There are over 50 people in our 30 communities who are receiving weekly educational offerings, either a video or a flyer or an encouraging message or devotional. All of these are also going out to all of our extended care patients. And our staff has gotten super creative, but this is one of my favorite ones. So, and it's really short, and you guys will be able to love it because it uses a lot of the things that we love to eat when we're down there. So you see, now you know how to make salsa with moringa to increase the nutrition level and make it with meat or with chicken. And Berta had the best time. She wanted to do this so badly. So it was really cool that all of our staff has gotten involved in education offerings that have been going out. So you can see the list has continued to grow of all the things that they're doing. The really exciting thing for me is these are not just staying in Honduras. There is a Latino community outside of Charlottesville that is supported by Habitat for Humanity of Charlottesville. And they asked to have access to our videos, our Spanish speaking videos. to use with the folks in that community. So they are using them likewise to teach about COVID and prevention and those kind of things. So that's really exciting. So what still needs to be done? We still need to finish developing our overall transportation plan. Giovanni is working on that very hard. We do have some initial ideas on how we want to do that, but as we said before, being on the bus, being in the trucks, transporting everybody for an hour to 2 hours one way to go to a clinic is a lot of time of being cooped up in a small little space. So we're still trying to figure out some of how that's going to work. Hopefully by the time we actually get on the ground, we don't have to worry about it too much more, but we'll see. We need to finalize our action plan for if someone becomes sick with COVID while they're in Honduras. What can we do? What does the government want us to do? What will the airlines allow us to do? Those kind of things. And then finalizing our 2021 schedule. Oh my gosh. And for that, I'm going to turn it back to Miss Katie.
All righty. If you don't mind, oh, there you go. So here is our tentative schedule for 2021, the dates there. You'll notice that September, we still have a need to fill a team there, the September 4th through 11th slot. And then we do have a lot of team leaders on this call. So one thing I want to let you guys know is I will be the point person for you guys when it comes to building these teams. We had a lot of team members who were supposed to travel in 2020, this year, that because of this, we've had to cancel, and there's going to be a lot of shifting around of team members, travel funds, and some of their flights have already been booked and then now canceled. So just to make sure that we have everything covered, if you just want to get in touch with me. We also want to let you know that while most of our team members travel with the same team year after year, we have a few stragglers who are willing to hop on any team. So we want to give them priority because they've already either paid or we have a flight booked for them for the 2021 year. So just as you're starting to build teams, just if you don't mind, get in touch with me and we can work through this process together. And like we have said before, we don't know what 2021 will bring, so we're going to just keep planning for it and continue to modify and make changes as need be. Back to you, Patty.
Well, it's actually back to Erin.
All right. Well, one of the things that popped up over and over again in the questions as you guys were registering for the conversation tonight was for those who were not able to go, how can you continue to be a part of the ministry, and how could your teams be, or in general, what could you people do to help? So whether it is your team that is wanting to continue to support, or a church, or you as an individual, these are some ways that you can continue to reach out and help with the work that is continuing to happen in Honduras. Obviously, Patty has shared with you the different ways that we are continuing to work. We are continuing to support the mountain communities, and as we've mentioned previously, the extended care program continues to work. There's 300 children that we continue to support in the ways that they need. So the ways that we have developed that seem most practical to support are, one, community partnerships, which is a big commitment, but if a team wanted to get together, or a church is considering a long-term partnership, as there are some people on the call that have churches that have those type of partnerships, a community partnership is typically an annual commitment. That's $3,250 for a long-term partnership. The other piece that may spark some type of interest with a team, perhaps, since they know the value of what is lacking and missing now in a community, given that the teams are not in those areas, and these communities no longer have access to medications. And during this time when they really need to be staying in their communities as they want to be. If they have a need, they will have to go outside of the community, which then poses a danger to them. What we're trying to do with this medicine cabinet program is keep them within the community as they wish to be. So that is, in order to give them that medicine cabinet, that would be a $500 commitment for a month to give them that medicine cabinet and that training and really that telemedicine, very, high-tech program where they get to work with Doctora and Pasquala. And we really see that as a pilot program for something that we hope to continue even once the pandemic is over. We see that as something that will probably, if it's successful, will become something that stays on, and when our communities graduate from having the teams, that may become the part two. What happens after the teams no longer visit those communities before they become maybe a community with this other NGO that we've been working with, Aldea Global, that has a much more advanced medicine cabinet program. So we look at that as a step into the future, as well as a temporary fix for the time being to help these communities. So I think that's a really positive way that teams and individuals can help make an impact. And then obviously we do have 300 children who have needs. There are cardiac patients and neuro patients, and also a considerable amount of patients with sickle cell anemia who need medications each month. And that's a cost of $3,000 total a month for the organization. But those vary, some of those medications might be a couple $100s a month. And then certainly it can vary to, a lot to a little, depending on what type of medication it is. But that's a significant commitment from the organization, and something that we take very seriously. And those children are receiving not only their medications, but check-ins with our nurses. And that's an elaborate program at this point with peer groups and parent leaders who are stationed across the entire nation of Honduras. And our drivers actually drive across the nation and hand out medications to parent leaders who distribute those. So if anybody had any interest in participating in that, you can reach out to us. So there's a lot of ways to get involved. You just simply need to reach out and let us know if you have an interest. But at this point, we'd love to take any questions that you have on any of the above or anything that you've had. Carlos, you're up first. I see your hand. You're muted though.
Yeah, okay. So I have several. So based on the reduction in the dentist work that's being done, I'm guessing that you don't have room for me to include a dentist in my team next year. A U.S. dentist, that is.
I don't think that necessarily is true, Carlos. I think you could still do that. I am sure that there will be
garbles. I don't understand the answer.
I think you could still have your dentist go. I think Bo could still go if he wanted to. I think there'll still be plenty to do, but it won't be as extensive right now. Of course, by the time we get down there, that may have changed. And all of this is going to be fluid. All of it will be fluid. So we'll keep checking back in, but right now we'll go ahead and plan if he wants to go to add him on.
Okay. So you were talking about transportation. Do we have the new bus yet?
Not in country. The bus is still being built.
Okay. And my last question is, this, you have for the community partner for whatever does that one include the medicine cabinet as 500, or is those two separate?
It's separate because this is a new component that we've never had to that is new to us. Yeah.
Okay, so because we're already doing the 3,000 one, so if we wanted to do medicine cabinet with our community, that would be additional.
Right, right.
Okay,
In the past, that component was handled by what the team was providing.
okay, that's fine.
Okay.
Teresa?
Several questions. What happened to our coffee money? And can we get coffee at this point, or does that wait till we can go back again?
The coffee,
That's a good question. I have a limited supply of the whole bean coffee at the office. So I can send, if that's the kind that you want, I could send you that. Or if you want to come pick it up, we can schedule a time to meet at the office. But we are totally out of the ground coffee at the office, so that we'll have to just, wait till we can get things back and forth again.
Okay. The next question was the cost for the individual members for next year. Do you know what that's going to be?
Not at this point in time.
So we could tell people to plan that it'd be at least what it was last year, maybe a little bit more. All right, and then the next question is money that we put in for team funds. Where is that setting now, or has that been spent?
The team, so it has not been spent, but we will have to talk about how it will be divided, given that entire teams are not carrying forward. So we have not yet had, we will have to talk about how that will be moved ahead going forward.
Do you have any idea of how much funding each team will need to raise for the coming year? Or you don't know because you don't know about that other pot yet?
Right, no, it would be the same. It would be the same because the medicine cost is the same.
Okay.
But is what an individual team might have carried ahead because of funds that certain people may have brought, that part is not clear yet.
Okay.
Just because certain at this point, that part is unclear, because there have been people who have moved actually twice at this point.
Yes.
Are they carrying money from one to another? So we're not sure yet. That's become a little bit of a mess at this point.
Yeah,
So,
that's my problem, because Verana's team funds were all donated from another team. And if they're going to go in 2021, then at this point we would have no team funds. And my team was put together from people we garnered from other teams for the most part. So I'm back to starting from scratch again.
right.
I don't think necessarily that you'd be starting from scratch. I feel like there's still going to be enough for you to jumpstart without any other problems. I do feel like that's one of the specific places where there will be a larger pot that moves with you.
Okay.
You're kind of a little bit of an anomaly in this.
Yeah, I just want to, because I've not done this before in totality, I'm just kind of looking at, I need to go ahead and get started in order to have everything together by May.
And that's very true, understanding that there are still lots of unknowns. So yes, yeah. to talk to people and start putting those teams together, yes, by all means, I think that's a great idea. Getting them up to speed on the potential changes, the issues. I think one of the things that I didn't mention that we all need to think about, especially you team leaders, is if there's, who knows what it's going to look like, but we've got to encourage our potential team members who are 65 or older or have pre-existing health problems to think about, is this really going to be the right year, or do they need to wait until another year? So all of that, again, everything is very fluid. We don't know what it's going to look like. It continues to change all the time. Cases in the US are skyrocketing. Honduras is still kind of crazy. So there's lots and lots of factors. So there's lots of unknowns still.
Yeah.
Carlos.
So when will we know the deadlines for funds? I mean, I have the dates for my team next year, but I don't know when I need to deposit or the rest of the money or anything like that.
It'll probably, my guess is it'll probably be late August, the 1st of September. You know, we had gotten to where we were real, and we had been trying to give you guys, you know, more and more advance notice, and we'd gotten really good about, like, you know, really in August, and that's just not going to happen this year. It's gonna be late August, maybe first part of September, for us to be able to do that. And for Charles and Carlos and Joseph, we'll probably be working with you guys, you know, individually, probably in September, you know, and as we go along into those first couple of months.
The other thing is, can you provide a copy, the slides that were presented today, so I can share them with the people I'm trying to recruit to explain what we know at this point, and you know, so they can make an informed decision as to, you know, like you were talking about, you know, the people that are older and whatnot. Is this the year for them, or they want to skip, or, you know, that kind of thing.
Right. Well, that's why we're recording this, and I knew all of you guys would be asking lots of questions. So what I'll do is I'll just send you the link so you can actually get everybody together and you can play it for them.
And we are looking, and we are very much looking at doing things differently. It is a smaller group, and so most likely these will not be group purchase tickets. So that, because that requires us to have to purchase so far in advance. So if we don't purchase far in advance, that means we can work with a tighter timeline, which means not having to ask for money in this far in advance, which protects people a little bit more, which we want as much as you guys want. So you can assure people of that. We will try to keep tighter timelines for everybody, and we're working on kind of analyzing that. You know, so we're looking at all of that right now.
Very good, thanks.
So yeah, so it's a whole new environment. So.
Nari and Lydia, do you have anything you want to say, add, throw in there?
For me, just we miss you guys. We really, really miss you. And we are praying hard. We are praying hard to have you here next year. We really, really miss you, all of you.
And we continue working together from home, and families growing. Today we had a baby shower caravan for Lillian. She's about to have her baby. So we just drove by and brought a cake for her. So we're growing as a family in Honduras. We'll have new babies for 2021. And these kind of meetings make me so happy to see people that I know they don't know each other. To see Amy with Joseph and Teresa with Martha Reed, you know, it's amazing for me to see so many loved ones, love faces, and the love you have for my country, Honduras. You are all Honduran citizens by heart by now. Carlos, gracias. And I was counting, we have 3 board members. We have most team leaders here, and people that, past team leaders, that their heart is still with Friend of Barnabas. The only lady that I don't know is Elizabeth Laylaw. But the rest, you're all my family. Love you. Miss you so much.
Amy, you had a question? Unmute.
So
There
I
you
was
go.
just wondering what the overall morale of the staff, both in Honduras and here, and the community leaders is.
Well, let me tell you. We actually are, and you guys tell me if you think I'm wrong, but we actually are spending a whole lot more time talking together. Like I spent 2 hours today with almost the entire Honduran staff on Zoom, talking through their new policies and procedures for COVID at the Barnabas House. They have devotions together and do daily planning every single morning in Honduras. Everybody is being creative and really thinking outside the box and excited about the things that they are coming up with and their ability to provide care to all of our communities and our patients. So there's no sad faces. We're tired because our brains are tired because we're constantly having to think. But I mean, everybody's chipped in, and like Erin said earlier, we're all doing like all kinds of different things that we weren't used to doing, but we've all chipped in and it's happening. So
I want to add to that too. Thanks, Amy, for checking on everybody. That's sweet. And we've had so many hurdles that we haven't had to deal with before. And you know, it's having to go through those struggles together as a team and then overcoming and then celebrating those things, I think has just brought us as a team closer together. One of the ones that we're still in the midst of right now is we finally have been able to order medicines, and we got all the proper permits that took a while to be able to import them into Honduras, and we should be just moments away from clearing those from customs. But that's just one example of, it's been months and months of, feels like banging your head against the wall, and we're so close to that celebration. And there's been so many other things like that, like different grants we've applied for and things that, you know, some of us have never done before, and being able to celebrate those wins, I definitely feel closer as a staff.
Yeah, it's true. Everyone has really risen to the occasion. I mean, we have staff members who are now videographers who were not, and people who are, you know, making videos who were not. You know, Katie and Patty became grant writers. Instead of researching for flights, Grzina is researching for grants. You know, it's innovation is the key, and creativity is the key, and everyone has really risen to that. And you mentioned the communities. We have been so inspired by what has come from the communities. They have been so overwhelmingly grateful, and seemingly surprised almost that our outpouring has continued, that the education has continued, that when the nurses continue to call to check in, that they just say, you know, thank you for not forgetting us. Thank you for continuing to call and check. And they are so grateful. That's the overwhelming response. You know, and they have beautiful stories within the communities of one person helping another person. You know, it's the stories of humanity that you expect, that you want to see and hear, of neighbor helping neighbor. So that's really what feeds us, and it's the beautiful things. So we are trying to just, you know, push that out and kind of be some of the stories of hope that we think people need to hear and see, because there's good stuff happening out there, and we're trying to be a part of it and trying to make sure that good work happens. So, and we know that you guys want to be a part of it, and we want to put you guys out there as soon as we can. We just want to do it safely. So all the pieces will come together, and it's a really difficult time, but I really believe that FOB is going to be really stronger and smarter on the other side of this. Some of these things that Patty and the Medical Advisory Committee have laid out will stay this way afterwards. Some are temporary, you know, the dental clinic, it'll be full-fledged once this passes. You know, fluoride will come back and these things. But dividing the medical clinic into sick and well, that's smart. You know, some of these changes that we have had to analyze because of this time, we're better for it. So there's a real silver lining to all of this.
Erin, there's certain things that Mountain Medical teams miss from extended care. The response we have had from the parents, the solidarity, the bond of love we have seen on the parents of our patients, from Atlantic coast to Pacific coast, from north to south of Honduras, the way they have become a networking to transport with all the inconvenience we're having in the country for transportation. When they receive their medicine and they report back to us, it's amazing. It makes you cry and touch your heart, the response we have received from the parents. The gratitude is immense, and Patty can tell you about it.
Yeah, it is. It's really been fun to watch all of it unfold. And there's like things going on behind the scenes that nobody sees too. We have our EMR. Yeah, look at all the nurses going, yeah. Okay, our EMR. And so I'm loading ECP kids in it now, and we're until we can get back on the ground, get them using that, and then we'll start it with the Mountain Medical team. So like it's in my hand. So lots of things, lots of other things going on that are really exciting.
And there is a new Barnabas bus being built.
Yay!
That's right. And if it turns out, it'll be manufactured, if all the schedules stay straight, sometime in November. But how to get it to Honduras? It's kind of like trying to get a Mountain Medical team to Honduras. So not all those questions have been asked yet.
Yeah, and not all of the government offices being open is going to slow that down as well, unfortunately. But
Carlos.
Yeah, so I went to your website trying to get information about this, the medical cabinets for $500. And right now that picture shows up under community partnerships, and it gives you the impression that it's part of the 3,250. So there's no separate information that tells you, this is something separate that you get for $500. So I want to bring this to my church, but it's not something that I can readily get from your website, that it's something separate that I need to convince them to pony up $500 extra. So
okay, so Carlos, let me address
separately in your website. You understand what I'm saying?
Yeah, we can work up. We can talk about that. We can send some separate information.
I would like to do that, but I need to have something that I can present to them and say, this is something we could do in addition to what we're doing now with our community.
Right. Yeah, none of that's on the website yet because it's still in design.
Okay.
Okay. So, but I've got a whole layout, a whole plan put together, program plan put together that I can share with you that will explain everything. So I'll make sure that happens.
Okay. We got money sitting in the bank. I want to attend it to you.
We will get you the information, Carlos. Don't you worry.
Teresa?
I had made this offer to Katie, but since there's so many team leaders on here, I want to let you all know I do not work anymore, and I have a nice big truck with a cover on the back of it, and I can, if somebody has trouble with transporting team bags, not having an appropriate vehicle, I'm willing to help get team bags from Friends of Barnabas to wherever you all are, to get them to the airport. If it means I have to get up early, drive all night, I don't care. I love to drive. I love to go places. So if a team has all its members together, but this is a sticking point or a problem, let Katie know. She can get in touch with me and we can work something out to help you all out.
Thank you, Teresa. We appreciate
Thanks,
it.
Teresa.
Hey, Kip, I think we have a bus driver now.
It does sound like it.
Oh,
I'm taking names.
And yes, I do drive buses. I've driven ambulances. Just
Oh,
as long as
my.
it doesn't have air brakes. I'm not certified on air brakes.
Miss Marie.
Yes, hi. Hello, everyone. I just wanted to say that this meeting has been very inspiring for me. I think to hear all your insights, your question, and your desire to help. I live in Honduras with Nuri and Lydia, close by. And this, we're just trying our best to bring you back to Honduras. And I think everything happens for a purpose. Everything is, God is guiding us through what that purpose is. And as Erin said, we'll be a stronger and better organization. And this has, as Nuri said, strengthened the people of Honduras. And it has shown the solidarity that Friends of Barnabas has, and that will be greatly appreciated and replicated in their community. So thank you for that.
Thank you, Ruth Marie. Ruth Marie is our vice chair of the board of directors. So we appreciate all the things that you do for us, madam.
Yes.
Anyone else have any questions?
Exit. Okay. I think we missed one from Kip. Kip was asking about a construction team in 2021, and I think at this time we do not have one on the schedule, but that does not mean that there won't be one. So, anybody else have anything? We want to respect your time. We're trying to keep to an hour, so we don't want, everybody's got lots of other things going on in life these days. Not many places to go, but I'm sure there's other things happening. So, but we do appreciate you. We appreciate you gathering here tonight. If you have a desire for us to tell the story to another group, please let us know. We're happy to, if you want to get your team together or a former team together, please do so. We'd love to join a team reunion. We'd love to get your, whether that's an old group or your current group, get them together. We will update them on what's going on in Honduras. We'd love to share what's happening. So we've done, this is happening a couple nights this week, but we've also shared other stories of what's going on in Honduras. We're happy to do that. So just let us know. But we appreciate your support and your concern and you being with us tonight.